Hey, it's Scott. And in this week's Gimme 5, I just wanted to do another quick review when it comes to the basics of Braslo, otherwise known as how to actually properly play with your Braslo tape. And specifically in this one, what we want to touch on is epi. Because there's several misconceptions, and more importantly, there's several chances for error when it comes to epinephrine in a sick kid. So first of which, remember, no matter what color you are, when it comes to epinephrine, up top, it's listed under the section that says resuscitation. That's important. Because if you are looking in this section, it's because your child is sick enough that they require resuscitation. And therefore, that's where you should be looking for the epi dose. However, the first one, to no surprise, is going to be IV or IO, because that's most commonly what you're going to give in resuscitation is epi-IV or intraosseous. However, remember that underneath it says epinephrine ET. And that means not the classic Steven Spielberg movie, but this means the whole idea of epinephrine down the tube. Not done for many, many years, but it's still on the tape, and occasionally you might see it still done. So with that in mind, if you are giving epi for resuscitation, go for the top one under the resuscitation section, and that'll tell you how much epi to give. Now, where this comes into play in regards to common errors involves resuscitation, meaning your kid is actively trying to die, versus anaphylaxis, meaning they're having a horrible allergic reaction. So the easiest way to remember this under stress is read the tape. Resuscitation means resuscitation. That's if you're having a child who requires resuscitation. If, however, you have it for anaphylaxis, remember on the latest version of the tape, if you come over to the section where it's entitled No IV, Quick Access Meds, that means, to no surprise, you have a kid who doesn't have an IV, and you quickly would like to give them some meds. So why that's important is if you follow it down, if you notice, unlike the other section which says resuscitation, this one, hint, hint, is entitled anaphylaxis. So if you're giving epi for, anaphylaxis, look in the section that's entitled anaphylaxis. And why this is important is a couple-fold. The first of which is the top one says I am epi, and it's 1 milligram per ml. That, you remember, is the little tiny 1 cc vial, and that's what we're going to be giving only for anaphylaxis. And if you follow it across, it will tell you in the anaphylaxis section how much intramuscular epi, because you don't have an IV, epi you need to give. Take that one step further. Underneath is where it says epi auto injector, otherwise known as an EpiPen. And if you follow this across, this will remind you as to, depending on how big the kid is, as to whether to use the EpiPen Junior or the big old EpiPen. Now, why this really, though, is important is, remember that EpiPens are like seriously way expensive. And number two, like many drugs, they actually expire far quicker than you would imagine. So a lot of services have gone to drawing up the little 1 cc vial of epi. So if you're trying to remember how much to give, everything is color-coded. Just find the intramuscular epi, follow it across, and that's how much intramuscular epi you need to give. Now, the last part is just kind of neat, and that's what you're going to see in the very near future. At a recent conference, I was going through the exhibit hall, and the same people that make nasal Narcan up the nose for a heroin OD, now they're coming up with epinephrine up the nose for anaphylaxis as well. And in talking with the rep and reading the research, personally, I think this is going to be a game changer. Because understandably, kids having a nasty allergic reaction don't want to get a shot. So with that, this is probably something you're going to see far more of coming in the future. But if you remember nothing else, when it comes to epi and the tape, resuscitation means resuscitation. That's your epi dose for resuscitation. If you don't have an IV and you're giving it for anaphylaxis, remember, go to the section where it says you don't have an IV Find the part where it's entitled Anaphylaxis and give the dose of Epi.